much of what we were talking about today was our kind of multidisciplinary approach. We have specialist nurses who come to our clinic as well. We get to know them very well, we get to know their families very well, so we try and tease out if there are other underlying issues and try and support that. We very much try and encourage them to continue to live a normal life and not be completely overtaken by their cancer diagnosis, because especially with prostate cancer, they can have it for years and they can be very well for years, and if they are consumed by the diagnosis, then actually they don't make the most of those years that they do have left, even without very few symptoms, because they're so consumed by it. We encourage them to be as active as possible, to carry on things as normal. We have leaflets about exercise, about diet. We also try and see if there's issues, if they are struggling psychologically, and we try and address them proactively, although I suspect we don't always do that as proactively as men are men and old men are old men, and I think sometimes they don't always let on either. They often come with their wives, and it's often their wives doing that let us know there's something up. So in Glasgow we're very lucky because we've got the Maggie Centre, for example. So the Maggie Centre is a hugely beneficial centre for a lot of patients. It's right beside the Beatson, but it's separate, and that's very deliberate, and they can get an awful lot of support there. There's also a Friends of the Beatson centre in the hospital itself for inpatients. Down in Ayrshire it's a wee bit difficult, because if they wanted to go to the Maggie Centre, where they can get lots of emotional support and various other alternative therapies, there's an awful long way to travel. So there are some specific Ayrshire services. Some of that's through the hospice, some of it's through separate charities. So you just need to know what's available in your area and persuade people to, and not everything is right for everybody. So again, it's getting them to try something, and if it doesn't work, maybe try something else. Quite often a lot of the men get a lot of support just from the other wee guys beside them in the waiting area, because they all tend to come back the same weeks for their treatment, and they chat to them and they get support from that, and that for them is a bit better, because it's not a group that they're going to.